I'm Ant, and I'm here to talk about living with HIV. I put myself at risk, and I then was ill for a little while, and I eventually plucked up the courage to go and get tested, which was a couple of months later, and that was just before the Christmas of 2006. And then just after New Year, I got a call from the clinic and said, you need to come back in, there's something abnormal about your test, and it went from there. I think, to begin with, it was really difficult to kind of cope with. Now, sort of 6 years on, things are very different for me. I'm live kind of a very sort of happy, normal life, really. I take medication once a day. Now, HIV is not a very big part of my life, really. I kind of choose to push myself forwards because I think it's really good to have more people talking about HIV. So I put myself forwards in that respect, and I suppose HIV is a big part of my life in that respect because I do volunteering and kind of activism around it. But in terms of my own sort of personal health and what it means for me personally, it's not a huge thing, really. I take medication once a day, and it becomes very routine, actually, just taking medication once a day. I mean, it's like one of those routines that you have in the morning. So you brush your teeth, go and have a shower, take my HIV medication. And so in terms of how I cope with it, that's it just becomes very routine, and that's actually means that it's very easy to cope with, and it means that it's very easy for me to stick to my medication, adhere to my medication. My HIV is very well managed, certainly medically speaking, it's very well managed, and I have what's called an undetectable viral load. So that means that the amount of HIV in my body is at a very, very low level, so low that it can't kind of be detected by tests. So they kind of look at the number of HIV cells passing through my blood, and it's very well controlled in that respect. And that means that I'm very healthy, my immune system is strong, and it means that I'm looking at kind of a normal sort of lifespan, really. Testing is really important. I'm only in a situation where I'm healthy and living happily with HIV because I went and got tested very soon after I put myself at risk. And yes, it's so important that people get tested regularly, and that they, I guess, kind of start to think about HIV testing as something that is like any other sort of blood test that they might go for. Really, it's so important to go and get tested early and regularly, and by doing that, it's going to be a lot better for you in the future. New treatments are really important because what we're seeing is new treatments, new developments coming along all the time in terms of the science around HIV. And that means that as new medications become available, there are fewer side effects. It's much easier for people to take their medication and for them to stick to their medication, which means that the treatment's going to be successful, so that they're going to be a lot better off in the future. And it also means that if someone is doing well on treatment and they're undetectable, it means that they're also much, much less likely to pass on the virus. So there's kind of a public health sort of aspect to someone being undetectable and successfully on treatment. It's not only beneficial for them, it's also beneficial for other people that they're around.